As steps are taken to once again facilitate travel within the country, it can't happen without the strict guidance of the Ministry of Health. Cleopatra Murphy spoke today with the country's Deputy Chief Medical Officer, who detailed the process those hoping to travel will have to undergo.
As government moves to slowly resume inter-island travel, first consideration is being given to those on cleared family islands who have been stuck on New Providence and Grand Bahama since air and sea travel was closed to passengers due to the COVID-19 pandemic. Beginning Wednesday, those seeking to return home can register their travel plans with the Ministry of Health at email addresses covid19@bahamas.gov.bs and covid19travel@bahamas.gov.bs. Deputy Chief Medical Officer Dr. Jelon Brennan says following that, residents will be required to complete a registration form and see a physician to get clearance to travel.
Then they will be referred to a healthcare provider, either in the public sector or private sector of their choosing, of course, but we'll give them a list of where they can go. That healthcare provider will then do a risk assessment, so it's an exercise where a number of questions are asked to figure out what their risk is of COVID-19, and they'll also complete a physical exam to see are they exhibiting any symptoms that would be suggestive of COVID-19.
Brennan says if the applicant is deemed low risk, they will be granted a travel authorization card or letter that would allow travel for within the next 7 days. But if someone is high risk, they will have to undergo a COVID-19 test through the National Reference Laboratory and test negative before they can travel.
The Ministry of Health would be the authorizing body to issue the card. The doctors would just do the evaluation. Within 24 hours of receiving that information, if it's deemed that the person is able to travel, then the travel authorization card would be, or a letter would be produced.
Those traveling for work will also have to undergo the registration process. Brennan says if residents go through the public sector, there will be no cost attached, but if they attend a private doctor, usual fees will apply. In his address on Sunday, the Prime Minister stated that residents on islands cleared for commercial activity can also travel between New Providence and Grand Bahama. Brennan further explained.
I think other areas would be allowed as well, because we can't tell you specifically where all people are going to have a need to travel, whether that's traveling back home, whether that's traveling for work. The evaluation would be done once persons indicate their desire to travel, and then the authorization for travel would then come from the Ministry of Health. But of course, persons who are registering to travel by air would still have to go through the Bahamas Civil Aviation Authority, and those who are looking to travel via boat would still have to go through the Port Authority.
Brennan says persons looking to travel after the 7-day period on the travel authorization card has expired will have to register again. Islands that have been cleared for commercial activity are Cat Island, Long Island, Abaco, Andros, Mayaguana, Inagua, Crooked Island, Acklands, Long Key, Rum Key, and Ragged Island. Cleopatra Murphy, ZNS Network News.